All right, today we're diving into a medication that so many people recognize. You know, the classic blue inhaler. We're talking about salbutamol, which you might also know as albuterol. It's built to do one job and do it incredibly well. Open up tight airways and do it fast. So let's get into how it works.
You know that feeling, right? It's genuinely frightening. That sudden squeeze, maybe a wheeze, and that awful sensation that you just can't pull in a full breath. It's something millions of people experience, and it's the exact problem we're tackling today. So the whole story really boils down to this simple but incredibly powerful sequence. It all starts with a problem, tight airways. That leads to a solution, a rescue inhaler. And it all ends with the goal, sweet, sweet relief. For so many people, this simple chain of events is an absolute lifeline. So let's start at the beginning, with the core issue itself. Section 1, when breathing gets hard. Okay, so picture the airways in your lungs like little flexible tubes. Now, during something like an asthma or COPD flare-up, the tiny muscles wrapped around these tubes start to squeeze down, hard. They narrow that path for air. It's kind of like trying to breathe through a pinched straw. Not much gets through. And that squeezing action, well, that is the exact problem this medication is engineered to solve. Which brings us to Section 2, your fast airway opener. Salbutamol is part of a class of medicines with a really cool descriptive name. It's a bronchodilator. And if you break that word down, it's pretty neat. Broncho refers to the airways, your bronchi, and dilator just means to widen or open something up. So it's quite literally an airway opener. So who's it for? Well, its main job is to give you quick relief from those classic symptoms, the wheezing, the coughing, the breathlessness of asthma and COPD. Some doctors might also prescribe it to use before exercise to stop those symptoms from even starting. But how does it actually do it? I mean, how does it tell those squeezed up muscles to just let go? That's the real magic we're going to get into in Section 3, how it unlocks airways. Okay, so here's how that chain reaction happens. When you inhale the medicine, it goes on a mission to find these specific docking stations on your airway muscles. They're called beta-2 receptors. As soon as it locks on, bam, it sends a powerful signal straight to those muscles with a very simple message. Relax. The muscles listen, the squeezing stops, and the airway opens right up. And here is the absolute key. It is fast. This isn't some medication that takes hours to kick in. You're meant to feel that relief within minutes. And that's exactly why we call it a rescue or reliever inhaler. But you know, with any medicine that acts that powerfully and that quickly, there's usually a bit of a trade-off. And that brings us right to Section 4, benefits versus side effects. So the benefit? It's crystal clear. You get fast, powerful relief right when you need it the most. Now, on the flip side of the coin, you have some pretty common side effects. See, that same signal that tells your airways to relax can sometimes give you shaky hands or make your heart beat a little faster, maybe even give you a headache. The good news is these effects are usually temporary, but it's definitely good to know they can happen. Now, this slide here, this is so important. I want you to think of your rescue inhaler like a fire extinguisher. If you find yourself having to use it more than twice a week, that doesn't mean the extinguisher is broken. It means you're having too many fires. It's a huge warning sign that your underlying condition isn't being controlled properly, and it's time to have a chat with your healthcare team. And there's one rare but very serious warning you need to know about. If you take a puff of your inhaler and your breathing suddenly gets worse instead of better, that's a medical emergency. It's called paradoxical bronchospasm, and you need to get urgent help right away. Okay, all of this leads us to what is probably the single most important idea to grasp about this medication. Let's talk about Section 5, the crucial difference between rescue and daily control. Think of it this way, salbutamol is the rescue. It's the firefighter that rushes in to put out the fire by relaxing the muscles. A controller medication, on the other hand, often an inhaled steroid, that's your fire prevention system. It works slowly, day in and day out, to calm down the underlying inflammation that makes those muscles want to get twitchy in the first place. One is for right now, the other is for every day, and you absolutely cannot swap one for the other. To pull all this together, we've got a great little acronym. Just remember the word relief. R is for reliever, not a controller. E is for easy breathing in just a few minutes. L is for look out for those common side effects. I is for interactions matter, a big one being with drugs called beta blockers. E is for excess use is a warning sign, and F is for flag any rare problems, like worsening breathing immediately.
And that point about interactions, we really can't say this enough. Some medications, especially a type of heart and blood pressure drug called beta blockers, can actually fight against what salbutamol is trying to do. That's why your doctor and pharmacist need to know about everything you're taking, no exceptions. And hey, one last practical tip. An inhaler only works if the medicine actually gets where it needs to go, right? So using it correctly is everything. For a lot of people, a simple device called a spacer can make a world of difference, helping that medicine get deep down into the lungs instead of just hitting the back of your throat. So we'll leave you with this question to think about. Salbutamol is an amazing, often life-saving tool that provides relief right when you need it. But really, the goal of good asthma or COPD management is to need that tool as little as possible. So ask yourself, is your rescue inhaler a tool you use every now and then, or has it become a daily crutch? The answer tells you a whole lot about how well things are really being managed. And of course, please remember, this explainer is for educational purposes only. It is absolutely not a substitute for professional medical advice. Always, always talk to your healthcare provider about any medical questions or concerns you have.